Hi, I'm Dr. Kormeili, board certified dermatologist. Today we're going to talk about chemical peels. Chemical peels have been around for a very long time. In fact, Cleopatra was known for her sour milk baths, which was probably lactic acid that she would extract from the milk to be able to brighten her skin and keep it beautiful and glowing. Well, a lot of advances have gone into chemical peels, and chemical peels are as generic as the word battery. When you say I have put a battery in my phone or in my car, they're very different kinds of batteries, and chemical peels are like that too. So just like a car battery is a lot more powerful than the battery in your watch, a chemical peel can be a very gentle acid that lightly exfoliates with no downtime, no burning, no stinking, to something that is going to take off the first and part of the second layer of the skin and require months of healing potentially. So when we choose a chemical peel, we have to sort of pair the patient and the pathophysiology, what's wrong, with the skin type we're seeing, because not every skin type can withstand the effect of a strong chemical peel. Having said that, all chemical peels have something in common, that they help exfoliate the skin. Your skin cells are glued together by tight junctions, kind of like your fishnet stocking is kind of woven together. When we use these acids, we basically decide at what layer we want to break these bonds, and the skin cells exfoliate away, and that's where the shedding comes into place. The deeper we go, the more we can lift off of the dead skin or the skin that we eventually just chemically exfoliate. There's always a caveat to this, because right where the first layer of the skin, called the epidermis, meets the second layer of the skin, called the dermis, is called the dermal epidermal junction, right? So the junction between layer 1 and 2 hosts melanocytes. Melanocytes are the pigment cells that make melanin, the pigment in your skin. If you have ethnic skin and we go very aggressively to peel your skin, or shine lasers or anything like that, if we disrupt these melanocytes, it's kind of like breaking eggs. Everything is going to spill out. It's going to go all over. It can fall deeper into the skin and cause deeper pigmentation, and it can scatter all around and cause superficial changes as well. So when we work with ethnic skin, we always want to be like stealth ninjas. We want to get in there, exfoliate lightly without causing any collateral damage to the pigment cells, because we don't want them to release more pigment. What do we do in a chemical peel? We figure out what problem we're trying to solve. Are we trying to go for deep wrinkles? Are we trying to even the tone and texture? Are we trying to treat acne? Are we trying to get rid of some of the brown spots? Are we improving melanocyte function in terms of melasma? Or are we trying to get rid of DNA damage skills, exfoliate it so the skin can regenerate itself with healthier cells? Once we have our goal set, then we can choose the acids we're going to choose, and we can figure out how aggressively we want to go, because the pathophysiology of every disease is at different layers. And we can take into consideration things like downtime, if you're going to be exposed to the sun, the quality of your skin, and your ethnic makeup. So that's kind of chemical peel 101 in a nutshell. And we love chemical peels in this office because we can produce really predictable, effective results. The downtime is usually about a week, and nothing we do here is painful with chemical peels. So if you have DNA damaged skin, sun damage, melasma, acne marks, any uneven tone and texture with your skin, chemical peels can be an excellent solution to be able to restore your glow and improve the health and function of your skin. We'd love to see you and help you achieve your best results.